Hi, my name is Krishna Kapoor. I'm a second-year resident at Christus Good Shepherd Longview Internal Medicine Residency. And our project is called Choose Breath, Not Death, and it's specifically about improving lung cancer screening rates in our Christus Internal Medicine Resident Clinic. And the reason we chose lung cancer is because it is by far the leading cause of cancer death, making up about 20% of all cancer deaths. And lung cancer screening is something that we believe is significantly underutilized. And the data does back that up because only about 5.8% of patients who are high risk patients for lung cancer being defined by the USPSTF as those who are age 50 to 80 with a 20-pack year smoking history. And who are currently smoking or have stopped smoking within the last 15 years. And so these high-risk patients, of them, only about 5.8% of them are screened for lung cancer in the US. And then that number drops down to 1.8% of all patients are screened in Texas, of high-risk patients are screened in Texas. And so we wanted to increase these rates of lung cancer screening, specifically within our East Texas patient population because East Texas has the highest rates of smoking in all of Texas. So our objective with this project was to increase rates of lung cancer screening by 5% within 6 months of our intervention, and then 10% within 1 year of our intervention. And our intervention was specifically focused on resident education on how to screen patients for how to determine if patients are eligible for screening for lung cancer, including how to calculate smoking pack years, how to have these life-saving conversations with patients on the importance of getting screened for lung cancer, and then finally, how to use our Epic order set for lung cancer screening. Epic being our electronic medical record system that actually tracked in our resident clinic rates of lung cancer screening per quarter. So in quarter 3 of 2022, before our intervention, lung cancer screening rates in our resident clinic was at 42%. Our intervention was laid out in um, quarter 4 of 2022, where we educated residents in various settings, including morning report and in our clinic meetings before we started clinic. And during this time in quarter 4 of 2022, lung cancer screening rates increased to 44%. And then immediately after our intervention, in quarter 1 of 2023, lung cancer screening rates rose to 52%. This was the increase we were hoping for. However, lung cancer screening rates did come down in the subsequent quarters of 2023 to 48%, and then 49%. So our project demonstrated that that resident education can effectively increase lung cancer screening rates um, in the clinic setting. Although we do acknowledge that lung cancer screening rates did start to fall as we got more than 6 months away from our intervention of resident education. So this highlights the need, we believe, for possibly continuous resident education about lung cancer screening, and as well as other interventions, specifically patient-centered interventions, such as using questionnaires to determine why patients are declining lung cancer screening, as well as going out to the community to educate patients about the risks of smoking and the life-saving effects of lung cancer screening. Thank you.